I'll just do a really, really quick. I know, and it's like, right. Welcome to Fox 10 News. Your time is now 11 a.m. I'm Chelsea Sayason. Thanks for joining us today. We are awaiting Governor Kay Ivey. I'll probably just stop after a joint press conference. And if she's coming out, she'll probably be ready to speak. That'll give her a second to get ready. Okay. Okay. Yeah, this is helpful. Yep. Thank you. Okay, that's perfect. Thank you. Okay. Welcome to Fox 10 News. Your time is now 11 a.m. I'm Chelsea Sayason. Thanks for joining us today. We are awaiting Governor Kay Ivey and State Health Officer Dr. Scott Harris for a joint press conference. They're ready to speak now.
We're very grateful. And while in the middle of the COVID-19 virus, certainly we're all concerned about our health, but now many of our friends are also having the extra burden of having to deal with a damaged home or vehicle. And so we all know that you can replace a building, but you can't restore your loved ones. So we are grateful that no lives were lost in our state on Sunday. Our thoughts and prayers continue to be with our neighbors to the east and west, and they've certainly had a lot more deaths than we did, and property damage as well. And I'm offering to Governors Reeves, Kemp, and Edwards our condolences in this time of loss in their states, and also our offer to provide any resources that they would find useful. That's what neighbors do. Neighbors help neighbors. But turning our attention back to the COVID-19 pandemic, I want to give you a more in-depth update on the progress that we are making with our current stay-at-home order, which runs through April 30th. And while I'm personally grateful that so many people appear to be staying at home and taking the order to heart, all indicators suggest that it is working. And I cannot overemphasize enough the importance. In fact, it is imperative that we keep doing what we are doing. Now is not the time to let our guard down and pretend that things are back to normal. While some of the modeling suggests that our efforts have been paying dividends, many around the state are beginning to ask what are our plans about reopening the economy. And that's the same question that other governors are getting, and that President Trump is getting, and world leaders are being asked as well. So in these few minutes, allow me to give the people of Alabama an update on our plans to open our economy back, along with a timeline, in hopes that all things being equal, we can stick to this roadmap. And in all honesty, y'all, we've been working on such a plan for several weeks. As many of you know, I recently asked Lieutenant Governor Ainsworth to get the Small Business Commission, which he chairs, to begin looking for ways where we can restart the economic engine of our state, especially our smaller businesses. And as everyone knows, this is not a simple process, just like flipping on a light switch. But the Lieutenant Governor and this commission have been working to bring forward a set of recommendations that I trust will be valuable and helpful, and I hope to receive their input by this coming Friday. Over the weekend, my office contacted each of the 7 members of our congressional delegation to ask that they look at this challenge on a district-by-district basis by setting up their own individual working groups in their respective districts. And y'all, I was pleased, so pleased, that all 7 immediately jumped on board to be helpful. As I've said before, Grove Hill is not Gadsden, and Decatur is not the same as Dothan. It's especially true that our economy, that there's many differences, economic differences in our state as there are geographic and regional differences. Our House delegation will have their report back to me on or before April 22nd. As y'all would expect, I'm getting a lot of advice, and I'll admit it's a lot of free advice on what we could do, should do, or must do to get our economy going again. But my staff and I are taking every suggestion serious, and we're looking at it, and we've had some good ones come in already. But I intend to take all of these suggestions and recommendations and ask 6 members of my coronavirus task force to help my administration begin to vet all of these good ideas. These 6 individuals will serve on an executive committee, and they will work to put together a thoughtful, well-planned timeline for us to open up the economy. And keep in mind, though, that these recommendations will have to be carefully integrated into the advice that we're receiving from Dr. Harris and our medical team of experts from throughout the state. On or before April the 28th, Dr. Harris and I will review these recommendations so that we can provide an updated plan of action before the current stay-at-home order expires on April 30th. And going forward, we'll hopefully be able to give regular updates on what segments of the economy might be in a position to open, including when and how, while also allowing our businesses, both large and small, ample time to plan for a safe, responsible reopening. This will be a roadmap that will help Alabama begin our road to recovery. As governor, I have the responsibility to look after both the health of our people as well as our economic health. On a conference call yesterday with my Secretary of Labor, I was reminded that we have had more than 264,000 people file for unemployment here in Alabama in just the last 4 weeks. That's in stark contrast to the number of unemployment that was filed a year ago in 12 months of 130,000. We can take both the economic health and well-being of our state seriously, just as we can look after the safety and well-being of our people. We can do both of these things at the same time, and y'all, that's what Together Alabama is all about. That's our task at hand, and I'm confident that we can handle both of these tasks at the same time. Now I'd like to ask Dr. Harris to come forward and give us an update on the pandemic and comment on any of the things I may have mentioned as well. Dr. Harris.
Thank you, Governor. Good morning, everyone. Thanks for being here today. Our latest numbers, as you are probably aware, show us having about 3,800 confirmed cases so far in the state. We're just over 100 deaths. We're still in the process of confirming those. We've confirmed about 3/4 of those, but presumably most, or if not all of those, will be confirmed. So about 100 deaths so far. As of this morning, our hospitals have reported that they have about 400 inpatients currently who have tested positive for the virus that causes COVID-19. There's around another 600 or so inpatients who are currently being tested. Not all of those will turn out to be cases of COVID-19, but although some of them certainly will. And I would say that that's about where we expected that we would be. We have seen a lot of modeling change, as you know, over the past week and even the past 2 days. Our predictions look a lot better than we first thought when we were talking about this a month ago. The models certainly do change as we get closer to the time of an expected surge. And it looks at this time that we feel fairly confident that whatever surge we may see in the next week or so can be handled within the 4 walls of our hospitals, which is exactly what we would like to see. We certainly have been worried that we would have not enough hospital capacity, or that we would need to have an alternative care site in different areas to take care of patients. And at the moment, that does not appear to be the case, although we still have some turnkey ready facilities that we feel like could be up and running very quickly should we need to do that. But at the moment, the numbers look as good as we have seen them, and so we're very encouraged by that. The reason that has changed is because people have been taking seriously the order to stay at home. There's certainly some changing in the mathematics and statistics and looking at other things that affect the model, but the thing that has affected the modeling the most is the fact that we have a stay-at-home order that people have, by and large, been taking seriously. I was very gratified this week to get photographs of people who were sending pictures of their Easter services, and there were people who were meeting in their cars and in their parking lots, or just people who were meeting at home, and it was very gratifying just to see that people were really taking seriously and trying to live their lives and still respecting what we have asked them to do. So we know that we will continue to see cases. We are working very hard to make sure that we can test everyone that needs to be tested as quickly as possible. We have testing capabilities now, not necessarily every day, but pretty much every day in about 57 counties. We still have a few more that we're working to get set up. We have the ability to test in every county, although not as completely as we would like. And we also want to be sure that we can do contact tracing on all the people who do test positive, that we can reach those close contacts, and that we can isolate people who need to be isolated. So in public health, we are working very hard to add to our capacity to do this. We're shifting employees from other parts of the agency into roles where they can do contact tracing. We normally have a fairly small staff for doing this, and at the moment we've around just about quadrupled the number of people, and we plan to add a lot more as we can get them up and get them trained so that we can continue to do this. So overall, we've been very encouraged. I think I do want to remind you again of the health disparity that we see from COVID-19. This is a disease that disproportionately affects our African American citizens in our state. Like many health disparities, whether it's heart disease or infant mortality or certain types of cancer, this is a disease that has worse outcomes in people that already have other social determinants, like chronic health problems or issues just related to education and income. So this is a big concern for us in public health. We want to make sure our most vulnerable citizens are the ones that we are protecting, and we're committed to continue to doing that. So we certainly welcome this plan that the governor has today. The governor has done a tremendous job in leading this effort. It is her orders that have saved people's lives, and is the reason we're in a position to even be having this conversation. So I really respect that, and thank you very much for what you've done for that. So thank you.
Kim Chandler, you want to start us off?
Sure. Governor, do you anticipate opening everything back up at once, or do you think this is something that might be done in waves that's going to open terms within this?
It's got to be a reasoned process, and so it'll be over time and a segment by segment or region by region, because one size does not fit all. So that's the reason we've asked our congressional delegation to convene meetings in their respective districts, and I'm going to have 6 members of the executive committee on the coronavirus team members to vet. So it'll be a phased in segment by segment, because what restaurants and bars need to do is different from what a manufacturing or a retail store needs to do. So it'll be phased in. We want to get folks back to work as soon as we can, but we want to do it as smart as we can. Yes, ma'am.
Governor, President Trump recently said that he has total authority over when states can open up their economies. And the restrictions on COVID-19, what are your thoughts on that? Does the president have total authority, or will you lead the charge and say, okay, now it's time for Alabama to open up if maybe the federal government isn't on board with that?
Well, we certainly want to work cooperatively with our fellow governors across the nation and also with the Trump administration. But what works in Alabama works in Alabama. And so we're taking, we may have some ideas they hadn't thought of, and they may have some ideas we hadn't thought of. But we'll certainly work together and cooperate. But we're doing what we believe would be in the best interest of Alabamians to get back to work in a reasonable, orderly manner. Mike?
Governor, as Dr. Harris just reiterated, the COVID-19 is a lot worse for people with pre-existing conditions like diabetes and so forth, and those tend to be bad in rural areas where there are a lot of poor people. Has this pandemic and the circumstances caused you to more strongly consider expanding Medicaid? I know you previously said all options are on the table, but are you exploring that more strongly because of what's happened here?
Well, certainly we're concerned about the health and welfare of all of our citizens wherever they may live. But at the same time, it would be irresponsible to think about expanding Medicaid just for the sake of expanding Medicaid without having a complete and honest discussion about the source of stable funding to pay the match, etc. It is an option. I'm aware of the interest that's there, but there's a lot of exploring that has to be done on how you pay for it.
Any concrete steps planned on doing that exploring on those, finding a stable source of funding?
Right now, we're focused on keeping everybody healthy and figuring out how we can get our people back to work. Yes, sir.
Governor, there's not just in this country but around the world, there's concerns about reinfection when the economy is opened up. In your plans to restart the economy, what fact is the availability of testing a factor, or would you need to see more widespread testing available before we start seeing some of these segments of the economy reopen?
That's the reason we want to be sure that we're working as soon as we can, but as smart as we can to reopen the economy, because we could have a resurgence of this virus even this fall. And we've got to be prepared and be nimble enough to meet that crisis should it present itself. Over here.
Yes, Governor, what specific benchmarks are you looking for or milestones you're looking for Alabama to have set and you're determining when and how you're going to reopen Alabama's economy?
I don't know that we need to have any set benchmarks like that. We just are working to have a plan in place that will allow every region and every geographic location and every type of industry to have a say-so in the steps that are needed for that respective industry to get up and running in a responsible manner. Yes, sir.
Based on the models that you all have seen, when can we expect to see the peak of the virus in Alabama?
I'm sorry?
Based on the models that you've all seen, when can we expect to see the peak or the flattening of the curve in Alabama?
Dr. Harris, you may want to speak to that, but I think it's sometime between April 20 and 22.
Yes, ma'am, that's exactly right. We think the sort of peak demand for hospital beds will be around the 20th. For ICU beds will be around the 20th. The peak demand for actual total beds, hospital beds, may be a day or so earlier than that, but certainly within the next 6, 7, 8 days, something like that.
Dr. Harris, can you speak to what type of precautions are being taken at nursing homes? We've seen skyrocketing cases there. This is already a vulnerable population as it is. Is there any oversight, any plan to kind of put more protections in place for people that are there?
Sure. Nursing homes really are a very vulnerable population, and we've been engaged very closely with nursing homes since before we even had our first case. Nursing homes actually do a very good job of thinking about infections and thinking about outbreaks, because they do have a vulnerable population that's confined, and so flu season, for example, or gastrointestinal illnesses are things that they think about and have to deal with on a regular basis. So they do spend a lot of time working on their infection control plans. What we have brought to them are other ideas about how they can deal with actual cases. So, for example, when we have known positive patients who aren't sick enough to be hospitalized, we're encouraging them to cohort those patients, to keep those patients in perhaps a single wing or even a separate building if that's possible, to have dedicated staff and dedicated equipment to use only for those patients that are known to be positive. In many cases where we've had outbreaks, we have they have proceeded with testing everyone, trying to determine if they have asymptomatic infected people as well, and that allows them to isolate those people as necessary. And then our nursing homes are always having to work very closely with hospitals particularly when they're receiving a patient who's been diagnosed as infected and been hospitalized and then returning to the nursing home. They want to make sure those patients are no longer infectious and are clear. So there are a number of ways that we are working with them to make sure their people are protected. They really are probably the most vulnerable group that we have in our state.
You mentioned just briefly about the impact of COVID-19 on the African-American community. What are you all doing to address those issues in contrast with other people of color?
Yeah, absolutely. So African American Alabamians are very susceptible to severe disease, as we know. We've spent a great deal of time working with Senate Minority Leader Senator Singleton on ideas that he has had, and particularly in his district, but also statewide, in terms of reaching out to hospitals and providers, helping them to understand the particular susceptibility that they have. We are really trying hard to communicate and just get the message out. We think sometimes the problem is we're just not able to communicate as effectively as we would like to, and we struggle sometimes getting that message out to help people understand that they really are susceptible and really are at risk. But I would say over the past 2 weeks, or certainly the last week and a half, we've seen a lot of evidence that the message is getting out. People are not having the same kind of gatherings that we had seen before. They're not having for example, the large church services in the way that we've seen before, although they're finding other ways to meet. It has been a little bit of a challenge to get that message right, but we think we're improving there.
Can you explain your reasoning behind why big box stores can stay open when there are other stores selling similar items that say they can follow those same similar sanitation policies and they have less people? What's the reasoning behind that?
Well, the big box stores have a limitation of 50% of the fire marshal's occupancy rate, so they are limited to how many can be in the store at any given time.
But smaller stores, they said they can follow similar protocols. They can have 50% of the people allowed in.
Those may be some of the kinds of recommendations that we come forward to start being able to open up more businesses.
Governor, concerned that this creates a system of losers and winners, kind of going off of Lydia's question about having certain stores open and others not. Is that a concern?
What's your question?
Is it a concern that this policy is creating a system of winners and losers by having the bigger stores open and the smaller stores not?
The issue is not who can stay open and who can be closed. The issue is keeping people separated and apart and limit your contact with people. So that's the initiative. Certainly we can make improvements as we go along, and we'll continue to do so. But at the same time, the focus is on physical distancing and limiting the exposure to groups of people. Todd?
Is there an update on resources, PPE and ventilators that right now are going forward?
Yes, ma'am. In terms of PPE and ventilators, it is a day-by-day calculation. Right now, our best calculations on ventilators is that we're okay. We believe that the capacity in the state, which includes some additional ventilators that we've acquired and some others that should be here any minute, we think will cover the number of patients who are going to need those, particularly as our hospitals are pretty good at sharing with each other when they have these particular times. So we think we're okay on that. PPE is a different issue altogether. There's a worldwide shortage of PPE, as you know. The supply lines are completely changed, and it's difficult for everyone everywhere to get PPE, and we find ourselves trying to compete with other states for the same limited supplies of PPE. I think that's going to be an issue as we open the economy up, in that we probably will have, chances are we'll see recommendations about different kinds of behavior just for average citizens, people who are going out in public and wearing masks, for example, or in certain types of workplaces, maybe having to wear some degree of PPE. And so we continue to try to source that everywhere we can. The governor has an assets team that's done a great job of finding PPE for us. In public health, we don't know how to evaluate, a business offer from China, but the Department of Commerce and the governor's team are good at doing those things. And so we have been able to track some things down. We made a significant purchase or placed an order over this past weekend that we hope to get in within the next few days. So it's just a day by day.
Yes, sir.
Governor, I just want to clarify the timeline. You're saying that no currently closed businesses will be reopened before May 1st?
Do what now?
Governor, I just want to clarify the timeline. You're saying that no currently closed businesses by order of the state will be reopened before May 1st?
No, I hadn't said anything about May 1st. The order goes through, the stay-at-home order goes through April 30th.
Yes.
Dr. Harris, both you and Governor Ivey said that the indicators say that the stay-at-home order is working. What are some of those indicators that you're looking at to determine that the stay-at-home order is working?
You can do that too, but just look at this weekend's traffic. Aldine did a traffic count, and it was much lower than an Easter weekend traffic count it usually is. That's a strong, good indicator that folks are staying at home and paying attention and doing what they ought to do.
Governor, right back here.
Governor, I'm sorry if I misphrased myself earlier. I was asking, is there any chance that some businesses will be open before April 30th?
Before April what?
April 30th.
It's possible.
Okay.
All right, couple more questions. Brian?
Governor, when you think about these economic questions, is there a plan coordinated with the governors of Tennessee, Mississippi, Georgia? Is there a regional plan for reopening the economy so no state gets ahead of the others in these decisions?
We'll be glad to share our plan, but I have not been asked by any other state, nor have I reached out to another state and said, hey, what y'all doing? Like I said, we've been working on developing this plan for several weeks now because we all want to get back to work, and we want all of our people to have a good paying job because we had a strong economy going into this thing. Thank goodness we did, and we want to get back to that, but we've got to do it in a planned, methodical method to give the businesses ample time and opportunity to gear back up and find some creative ways to do their businesses that they hadn't thought about before.
And we have a question right here, Lydia.
Governor, a lot of people in the state have changed their life for social distancing. What does that look like for you? Are you working from the mansion more? Are you limiting how often you're around people? What does social distancing look for you on a daily basis?
Well, I'm staying alone wherever it is I am as much as I can, and I'm relying a lot on technology to stay in touch with groups, whether it's the mayors or the county commissioners or the hospital CEOs, certain legislators, etc. So technology, we're utilizing that and probably working twice as hard as before, but that's what we're doing.
One more question.
Governor, you mentioned in your remarks that there's over 200,000 Alabamians who are out of work right now to no fault of their own. What message of hope could you offer those people who are at home watching this? Their lives have completely changed. And can you speak to what the Department of Labor is doing to try to process those claims faster?
Well, the Department of Labor is working overtime and around the clock to process these claims. Like I say, they had in 4 weeks, the last 4 weeks, they had 264,000 applications as compared to 130,000 in 12 months last year. So it's an overload over there, but they are working to stay on top of it as best they can. And anybody who's made an application will get tended to. Don't feel like you're going to be left out. You'll get tended to. So it's a matter of patience there.
What encouragement did you offer those people, just as governor? What words of wisdom did you give those people that are watching right now that are out of work?
Well, the bottom line is the stay-at order has only been in place a little over a week, and it takes at least 2 full weeks before you can get any kind of data to evaluate. So April 17th is Friday, and that will be 2 weeks. And I know 2 weeks maybe sounds like a long time to stay by yourself or at home or with just your family, but time flies when you're having fun. So it's just imperative that we continue to stay at home and practice social distancing.
All right, one more question. Governor, do you anticipate that some closures will continue through May?
That's just speculation. I've got these teams in place, and we're going to listen to them and evaluate all the information that we get.
Do you hope to get the beaches open for summer?
Hope springs eternal. Thank y'all.
Welcome to Fox 10 News. I'm Chelsea Sayason. Thanks for joining us this morning. Now, we just heard from Governor Kay Ivey and State Health Officer Dr. Scott Harris. Now, Governor Ivey says that her team is working to have a plan in place to get Alabama back to what it was before COVID-19. She says that by April 28th, herself and Dr. Harris will look over all the recommendations from members of the Alabama Coronavirus Task Force and the congressional delegates. Now, Governor Ivey says every county is different when it comes to opening back up. She says over 264,000 people have filed for unemployment in the last 4 weeks. Last year alone, 130,000 filed in all 12 months. Now, Dr. Scott Harris says he feels encouraged that the stay-at-home order is working. Predictions are looking a lot better. Dr. Harris says that the state is doing okay with the amount of ventilators, but the percentage of PPE may be an issue when the economy opens back up. He also says testing is now available in every county, although they want more testing done. Thanks for joining us today. We will be back at 2:30 with Mobile County Health Department and at 3 p.m. with the City of Mobile. You can find all of these news conferences in their entirety on our Facebook page and YouTube page. We'll see you soon.
This has been a Fox 10 News coronavirus update. For the latest breaking news, stay with Fox 10 News on air, online, and on the Fox 10 News app. We now join our regularly scheduled program already in progress.